In this video, we will review approving a Brava treatment plan in Bria's Case Planner. When a treatment plan is ready for your review, you will receive an email from Bria's. You can click the link in the email to go directly to the treatment plan. Or you can open the treatment plan from Planner by clicking the Open TP button. Once the Brava treatment plan opens, the model of the treatment plan will be displayed. If a CBCT scan has been uploaded, the patient's teeth, roots, and bones are displayed. Otherwise, only teeth and simulated roots are displayed. There are two icons to toggle the bone off and on. You can check the superimposition, which displays the beginning and final tooth positions. Click the Initial button and the Superimpose FTA button. Click the Play button to see the simulation from initial to final. Note that the simulation may not match the actual path of tooth movement throughout Brava treatment. However, tooth before and after positions will be accurately reflected in the simulation. Click the Auxiliary button to view the intra-arch tooth movements provided by the Brava appliance, as shown by the blue sliding bar, and the auxiliary tooth movements performed by the doctor, as shown as the green sliding bar. Here are some examples where external anchorage and auxiliaries, such as elastics, are required to accomplish the Brava treatment plan. Molar and arch distalization, segmental mechanics for bite corrections, and midline shifts. Interproximal reduction, or IAPR, values are displayed in the treatment plan and are dependent on IPR being performed by the doctor. IPR should be performed by the third month of treatment unless the enamel surface is not accessible. If no IPR is desired, include the information in the comments when submitting treatment instructions. There is an icon you can click to toggle the IPR shown on the 3D model off and on. Please note, IPR is indicated by positive values while space is indicated by negative values. Review the midline correction. Review the bite and class correction. Review alignment and arch symmetry. You can use the measurement grid as a guide if needed. Review the overbite and overjet. Review the occlusal contacts. Use the occlusal contact colors tool to toggle the contacts on and off the model. Brava's pre-programmed arms deliver precise and accurate tooth movement, so overcorrection isn't typically recommended. Next up, we will review applying modifications to the Brava treatment plan. To request changes to the treatment plan, you can describe the changes needed and submit back to Bria's, or you can click on a tooth to begin making modifications. Click the Reject button to type a note for the Bria's team. Type the requested changes in the comment box, then click the Submit button to send back to Bria's. To make your own modifications, click on a tooth. Arrows will appear. Click on an arrow to move the tooth in the desired direction. Choose a curved arrow to rotate the tooth. To move a tooth gradually, click on an arrow or click and hold to grab the arrow and move the tooth in the direction you desire. When a tooth is selected, a table will appear to the right of the treatment plan. The table indicates the amount of movement applied to the tooth from the initial records. In addition to moving the tooth with the arrows, you can move the tooth by typing information in the table. Click the Apply button to apply all changes made when finished. Here's how to move a tooth on the 3D model. To move multiple teeth at once, you can click the Group Teeth Movement tool to move multiple teeth together. Here's how to move multiple teeth at once on the 3D model. To apply auxiliary movements, click the Move All Teeth icon. Arrows will appear. Use the arrows to move all teeth at once. Please note this will move the arches as a whole. Achieving arch movements will require the use of external auxiliaries. Click the Apply button to apply all changes made when finished. Here's how to move an arch as a whole on the 3D model. Next, we will discuss staging treatment with Brava Plus. While the majority of cases are treated with one Brava, some cases benefit from staged Brava appliances. When a case is staged, only a portion of planned tooth movement is activated with the first Brava appliance. The Brava's clinical team recommends staging to the provider when the following treatment goals are planned. Close extraction spaces if more than 4 millimeters. Expand an arch if more than 4 millimeters. Align severely rotated teeth if more than 30 degrees. To avoid confusion, identification marks are placed on every staged Brava appliance on the anchorage base. The first number before the slash denotes the stage. The second number after the slash denotes how many stages are planned for the case. While a staged case typically features 2 stages of Brava appliances to complete treatment, more complex cases may benefit from additional stages. Now we will review how to approve a Brava treatment plan. Once you are ready to approve the treatment plan, click the Approve button. A Confirm Approval dialog box will be displayed. Check the checkbox to agree to the terms and conditions of sale, then click the Approve button. The case will now go into manufacturing. Now we will look at viewing custom brackets in Brava's Planner. Once the Brava treatment plan is approved, the Brava's team will design the custom brackets. Once this step is complete, you can see the custom brackets in the Brava's Planner. This can be helpful if you ever need to direct bond a bracket for any reason. Click the Custom Brackets icon to display the brackets on the 3D model. Here's a helpful tip. By clicking the grid button, you can see the distance and millimeters for better bracket placement when direct bonding. This completes the review of approving a Brava treatment plan in Brava's Case Planner.